Welcome to Season 5 of AIHA's podcast series, The Healthier Workplaces Show, where we explore timely and informative topics about occupational and environmental health and safety. I'm your host, Alejandro Castillo. Today, I have the pleasure of speaking with owner and founder of MCHES Homestead, Megan MCHES. With over 20 years of experience in employee health and well-being, she specializes in delivering evidence-based mental health first aid and QPR suicide prevention trainings, along with customized workshops to leadership teams and work groups across the United States. Megan's work centers on integrating mental health into overall workplace safety, helping organizations build cultures where people feel supported, connected, and confident speaking up. Today, we're here to learn more about Megan's education session, titled Integrating Mental Health Awareness Trainings into Workplace Safety Culture, and her PDC Mental Health First Aid Certification Training. Both these sessions will be taking place at this year's AIHA Connect 2026 in New Orleans, Louisiana. Megan, thank you for joining us today.
Yeah, thank you so much for having me.
Let's get started. Before we dive into your PDC and educational session, can you share a little about what led you to focus your career on mental health, safety, and workplace well-being?
Yeah, absolutely. So my career has always had a focus on prevention, and that goes way back to my childhood, Alejandro. A topic of conversation often amongst my parents and aunts and uncles was the high cholesterol that ran in our family. And so I would hear conversations around medication and clinical trials that we're doing. And so I remember even from a young age, my brain thinking about, are there ways we could prevent this, through our lifestyle or maybe a healthy lifestyle in combination with medical intervention? So I've always had this prevention lens. When I was in college, I studied athletic training and sports medicine. And so we talked a lot about how do you prevent athletic injuries before they even happen in the first place. But a vast majority of my career, almost 2 decades, has been focused on prevention of chronic health conditions through lifestyle modifications and then through the workplace, really allowing employees to practice their healthy behaviors while they're at work rather than kind of damaging their health while at work. So I have had my own business for almost 3 years now, focused on mental health in the workplace. And same thing, the conversations really focus around how can we prevent mental health challenges at work before they become a crisis or before they become an on-the-job injury. So I would just say this thread or this theme of prevention has really just kind of ran through my career and continues to be very prevalent with the classes and things that I teach now.
Let's talk about your education session, integrating mental health awareness trainings into workplace safety culture. Your session frames mental health as a core workplace safety concern. What trends or data have you seen that make this such an urgent issue for employers and safety professionals today?
Yeah, absolutely. So this isn't new for your learners to be hearing about. I'll start with the data, though. There's a lot. There's a lot of different sources that could be cited. So I'll just rattle off a few that I commonly use in presentations. One is the American Psychological Association's Working in America survey, where 92% of American workers say it is very important for an organization to provide support for mental health. So our employees are expecting it. And also a majority of employees, 73%, say that work-related mental health struggles have hurt their performance at work. And so performance can be defined as their ability to work safely, their ability to be productive. Another reputable organization, Gallup, they have reported a lot on kind of workplace stress. And people are really reporting that, feeling the stress of getting all the things done that I need to get done at work and in my life at home require a lot of, bandwidth. And people are struggling and suffering because of that. And then finally, our United States Surgeon General, our past one, had 2 pretty landmark reports. A few, more than 2 landmark reports, but the ones directly related to this topic, a report on loneliness and workplace well-being, and then youth and social media. These are all kind of showing some drivers of epidemics of loneliness and well-being that can be impacted in the workplace through our communication and through our relationships. So that's just some of the data that, your audience is probably very familiar with. But AIHA represents some people who work in fields that are pretty demanding, people who might be doing shift work, spending time away from their families, some high stress and high stakes environments. Many manufacturing jobs and just many jobs in general can be pretty isolating at times. And sleep patterns can be disrupted, working a second or third or a swing shift, for example. So supervisors, and this is anecdotal from my experience and kind of what I hear from a lot of the people that I work with, many supervisors, they want to do a good job. So in work groups with really good cultures, they treat each other like family. We spend as much time with our coworkers as we do with our own families. And so they want to take care of each other, just like we want to take care of family members. So when someone isn't doing well, they want to help. So supervisors are really reporting, want to be able to upskill their confidence and ability to meet their coworkers where they're at in terms of their mental health rather than not doing anything at all. So they want to know, what are some evidence-based strategies that I can feel confident when I'm visiting with my team members and my colleagues.
Your session highlights evidence-based trainings like mental health first aid and QPR. What makes these trainings different from the typical awareness approach many workplaces take?
Yeah, well, I'm all for awareness trainings because they can help reduce stigma and also increase knowledge around mental health in the workplace. So awareness trainings definitely, they're better than nothing. They have their place. But with mental health first aid and QPR, and that stands for question, persuade, refer, that's a suicide prevention training. And there's other workplace trainings out there that have a good evidence base. These also have a skill building component, and they have some they've been, tested in the field. They have some research behind them. Many listeners have probably taken CPR at some point. And when you take a CPR class and then it's time to get down with the dummy and actually practice the chest compressions, it can be really daunting and nerve-wracking, right? Like those of us that aren't used to doing that, we might get really nervous. Well, similarly, if you're interacting with somebody who's having a mental health challenge or even a crisis, we feel better equipped to handle situations in real life if we have a little practice. So in our groups for these trainings, there's generally 30 or less people. So it's a very safe place. And we practice skill building, how to have those conversations. So in these trainings, we kind of all get to know each other and get comfortable with the topic. I've seen people, doing excessive nervous laughing during the practice. I've seen people cry and shed tears because it's very emotional to think about using these skills with somebody, especially somebody that's close to us, like a family member or a coworker, and seen a lot of discomfort kind of shifting around in the seat when it's time to practice. And it's all good because when folks have an emotional reaction to the content, it means it's really, truly important to them, but we're practicing it in a really safe, non-threatening space. So after classes, we collect pre and post data. We know that people are improving their confidence to host a conversation around mental health. So they're more likely to do it. They're feeling much more prepared. And they're also feeling more equipped to have a conversation around prevention. So early warning signs before things get to crisis situations. So I would say it's awareness and knowledge and also skill building that makes hosting evidence-based trainings a little bit more impactful.
Advanced registration for AIHA Connect 2026 is officially open, and we're heading to one of America's most vibrant cities, New Orleans. Advanced registration is open through March 29th, 2026. Register now for the best rates.
you did touch about this already a little bit, but what does success look like? Are there any
Mhm.
particular changes in safety culture or behavior that signal progress?
Yeah, absolutely. So, all great organizations have a focus on high performance, right? So, we're used to using data and, measurable progress for lots of different things. And we can definitely do that for well-being as well. So, I think organizations, and not just one person, but teams of people need to look at, what metrics can we use? What metrics do we have? But I also have a recommendation that's very in line with your audience. NIOSH has a tool called the Well BQ. So Well, WELL, and then BQ. And that's an assessment on worker well-being across multiple spheres, like one's work experience, the safety climate, physical and mental health status. And so individuals, employees, fill out the Well BQ, and then the workplace can get de-identified access to that data to target interventions and also measure progress. So, employers should really consider tools like the Well BQ. And why I bring that one up is because it's a tool developed in conjunction with partners, but also NIOSH. So again, we just have various dashboards, for our employees to look at around production and profit. So why not add a metric around, well-being? Safety is a logical place to start. Many organizations, track recordables and different safety metrics, but just kind of moving along the continuum, definitely using some of the tools that are out there for well-being. And I think that gives us some real measurable data points. Other ways you can measure success are some of the culture metrics too, anecdotal things, turnover, retention, and things like that.
Absolutely. So now that we have a basic understanding of what the trainings are, let's talk about how we can get certified. So let's transition to your PDC. What would you tell someone who's interested in becoming certified?
Yeah, if you have the opportunity to become a certified mental health first aider through your workplace or at AIHA, you definitely should. You'd be in really good company. There's over 4.5 million adults in the United States that have been trained. Mental health first aid has been adopted in more than 25 countries around the world. It started in Australia. And if you go through the course, you'll learn a little bit about the history and the evidence base for why mental health first aid is such a great training. It's truly the platinum standard. There's excellent outcomes for people who have gone through mental health first aid in terms of knowledge and attitudes. And, these skills really help people in all domains of their life. So if you go through mental health first aid as a part of AIHA, yes, you're getting continuing education credits. It's a part of the conference, but it's not just to help you at work. You could use these skills in your home, in your community, if you're a coach on the ball field. So these are really life skills that you'll be learning. And a few companies that I've worked with have circled back to say, that training that you led 2 years ago, I've had people come to me and say that they've used those skills. And ultimately, when we're helping to intervene, when somebody's having a mental health challenge or a crisis, we truly could be help saving a life. And so you never really know when these skills might come into play. But I think for any of us, if we can say, an impact I had on somebody might have helped save their life. I just can't think of what, better gift there could be. And I always like to use the analogy or the parallel to our physical health. Why do we learn CPR? It's so that we can provide life-saving measures until a professional arrives. And so I think of a lot of the mental health first aid skills similarly. I'm not the mental health expert or professional, and neither are you. But if we can help keep somebody alive or keep them thriving until they can get to a deeper level of care, what a huge win.
Absolutely. What a huge win. Now, this course emphasizes recognizing signs and symptoms of mental health challenges. What are some early warning signs that often go unnoticed in the workplace, and what can OHS professionals do to help?
So early warning signs or signs that just kind of creep up are things that we're very well positioned to notice in the workplace. These might be subtle changes with somebody. So an example is changes in appearance. So if somebody starts to show up at work and maybe they have some dark circles under their eyes or their eyes are a little bloodshot, that's new for them. That's different. As a mental health first aider, I might just notice, this is new. And if it's a few days in a row, I might say, wow, maybe there's something going on. Perhaps I'll have a conversation with somebody. So changes in appearance, changes in work habits like timeliness, the ways people go about getting the job done. This might be a lot of the behavior-based safety things that we talk about. Disinterest or sudden interest in certain things, excessive sleep or lack of sleep. And how we know about this in the workplace is sometimes people are just talking about it. They're just bringing it up in conversation, or we can notice it in the way that they're behaving. And then starting to talk about lack of purpose, lack of self-worth, or having very low confidence, and that's a change for somebody. So when I talk with folks, Alejandro, I often say, the way I was raised, if we would notice a change in somebody, that's their business and that's personal, and I should kind of stay out of it. And really what we've learned, I think, through research and trainings like these is no, if I care about that person and I have a relationship with them, it is absolutely okay to bring up these changes. And it's way better to bring them up early when we notice something before they go on longer and there's a crisis. In terms of early warning signs, it's just noticing changes in people. And then when we feel enough that we have a concern, it's starting a conversation. Privacy is really important. We don't want to do this in a big group and embarrass somebody. But really all we need to do is show concern, listen, ask some questions, and maybe the changes are explainable, but maybe the changes are the start of a mental health challenge. And if that's the case, we don't want to ignore that. We want to really connect people to resources that can help support them.
So let's say an OHS professional wants to start that conversation.
Yeah.
What is that sentence? How can they just walk up and start that conversation?
Yeah, that's good. Well, couple of things, and we practice these in the training, but I would encourage people, be yourself. There is no way that things will always come out perfectly. So if you're nervous or you're afraid to approach somebody, just think, where can I maybe do this in private? But just be yourself, show genuine concern. And then there's kind of a 5-step process that we go through in mental health first aid. It's an acronym called ALGE. And I can kind of, if you would like, I can kind of go through what those action steps are if you want that much detail. So in mental health first aid, there's an acronym ALGE that we go through. And the A is approach. So that's kind of what I just described, is we want to approach somebody about the change. Privacy is important, but just say, hey, I've, noticed this change, everything okay? And, we might need to try this a few times. If somebody says, no, nothing's wrong. But, sometimes we have this gut feeling. So anyway, A is approach. And then L stands for listen non-judgmentally. And so that's where we just kind of want to zip it. And we just want to listen. And sometimes that is the absolute most important thing we can do for somebody, is just listen non-judgmentally. And the research shows a few really positive things happen here. Someone that we're listening to, they can kind of hear themselves out loud, what they're saying, and that's very beneficial. It gives us some time to build a relationship with somebody. And as a listener, even if we don't quite understand or we don't quite agree with how they're feeling, we can still listen without interrupting and listen non-judgmentally. But listening is really, really important. So G is to give reassurance and information. And so that's a kind of an involved step that we practice a lot in the training, but we then really want to reassure people. And that might sound like, I'm not going to go anywhere. I'm going to be here for you, and I'm going to help you find the support that's going to help you. Giving reassurance might sound a lot of different ways, but we really just want to stay positive and let the person know that, hey, I don't even know what to do next, but I'm not going to leave you and I'm going to help you, something like that. And then there's 2 E's at the end of LG. So the first E for us to remember is to encourage appropriate professional help. And this is where we might talk about workplace resources or professionals in the community. Say, there's a whole world of people out there that are experts in this. They're doctors, they're psychiatrists, and it might be helpful to talk to somebody about this. The second E is encouraging self-help and other support strategies. And so this is where we might brainstorm with somebody about who else is there that we could bring into this conversation. Maybe it's a parent, a loved one, a sibling, a clergy member, a trusted friend. Who else can kind of help us with this? Or it might be connecting someone with, different social outlets or resources. So we do a lot of practicing of this ALGE action plan in the mental health first aid training for kind of varying degrees of a mental health challenge that's maybe early or a mental health challenge that's more of a crisis situation. But we can always kind of fall back on these ALGE action steps to help us work with somebody. And again, I just want to reassure the audience, if this is a new topic for you, having a framework can be really, really helpful. So if we can just remember, don't ignore things, listen, and then we're not the expert. We don't need to go it alone. We just always want to kind of get some help, get some other people involved.
Psychosocial Hazards 101, what every OEHS professional should know. Learn more about psychosocial hazards and how you can integrate mental health and well-being into traditional safety programs. Earn 2 contact hours on March 25th. Register today.
One thing I really appreciate is that you don't just focus on helping others. You also talk about caring for the mental health first aider. Why is that so critical?
Yeah, so caring for ourselves as the mental health first aider is one of the reasons that I really fell in love with the mental health first aid curriculum, and it made me want to become an instructor, is because to be effective at anything, we have to be good at taking care of ourselves first. So this is just that classic example of putting our own oxygen mask on first. And so in the mental health first aid training, we learn all of these skills, but it's like, I can't do these skills if my own tank is empty, So it really focuses on us taking good care of ourselves. And even as I'm talking, Alejandro, I'm thinking, 20 to 25% of all of us, all adults, will experience a mental health challenge in any given year. So it's not just us always looking, who can I help? It's us. I need to take care of myself too. So this is self-care, but it's also making sure that if we help somebody else and we provide mental health first aid, that we can debrief that, because it can be pretty exhausting or emotionally taxing if we're helping someone else, worrying about somebody else. And so mental health first aid really leans into us taking good care of ourselves kind of first before we, kind of go out there and try to help other people. So I think that's one of the best parts about the training. And then that also helps reduce the stigma that we often have around seeking help for mental health.
Are the signs or symptoms similar to what somebody who's a mental health aide would be seeking also? Or because how would you self-assess?
Oh, yeah, that's a really good question. How would you self-assess? So, I think it's asking ourselves, am I able to do all of the things that I need to do? Like getting up and getting to work on time. Am I enjoying my work? How are my relationships? Sometimes we're able to kind of keep it all together at work, and then at home, we might not be able to nurture those relationships the way that we need to. And that's really important for our mental health. Also, I want to encourage all of us to just know that at different stages throughout our life, things are going to change. There's some big milestones for people that impact our mental health. And I think sometimes society just kind of expects us to carry on as if things are normal. But, things happen like, growing families. So if people have children, that's like a major change. If people move or start a new job, or maybe they're with the same company, but they change jobs. So they're with a whole new mix of coworkers, or maybe we lose somebody in our life that we love. People are always kind of going through these major life events. And so, just because we were doing great a month ago, doesn't necessarily mean we're going to be doing great right now. So yeah, I think it's just continual assessment. And then also if people bring stuff up to us, we need to really listen to that, because they're doing it from a place of care and concern. So I think sometimes too, surrounding us with people that are willing to also be a mirror to ourselves is really wonderful.
Absolutely. Now, as we approach the end of this episode, is there anything else you'd like to share with the audience?
Yeah, I'm really thinking about your audience, especially as we prepare for AIHA Connect. A lot of people work in big organizations, I noticed, and the people I met last year. And well-being in the workplace and mental health strategy in the workplace, it's a team effort. So if you're an OEHS professional and you have other people in your organization focused on these topics, it might be HR, wellness, safety, etc. Take some of this learning to them, or see if there are ways to collaborate, especially if this is something you're interested in. One person alone should not be responsible for safety. We know this. Not one person alone can be responsible for culture. And definitely one person alone cannot be responsible for the mental health of the workplace. So I love that AIHA is leaning into kind of a whole person approach. This is referred to as the total worker health approach. So anytime you're upskilling yourself in the areas that you're not necessarily an expert in can be very, very beneficial to this total worker health approach. And then also for your audience that's listening, please feel free to reach out on LinkedIn and connect. Or if you're in New Orleans and you come to a session or see me or hear me, definitely reach out, because I am learning a ton being involved with your organization, and would just, love to meet you and continue to learn myself as well.
Megan, thank you so much for joining us today.
Thanks so much for having me.
That wraps up today's episode of the Healthier Workplaces Show. To learn more, visit the AIHA website and follow us on social media. Thank you for tuning in, and as always, remember that healthier workplaces mean a healthier world. Until next time.